See here we are doing the dissection of the face where we are focusing on the parotid gland. So this is how it was actually. So this is the ear, as you can see. We have opened till the ear. So to find out the parotid gland which stays exactly in front of the ear. Okay. So this is the gland, which is little difficult actually. We have opened the fascia to see this gland. This dark color what you are seeing, this is all like this is the parotid gland. So from the parotid gland you can see here emerging the large parotid duct. It lies right some finger breadth below the zygomatic arch. This is the area where we're gonna get the zygomatic arch. Below to that we have the parotid duct. Again from the parotid gland at its anterior border we will find the nerves, some bunch of nerves emerging out of it. So these nerves are facial nerves. You can see here one below the parotid duct, and there is another one here, we guess. So this is the upper branch of the facial nerve, and this is in between the parotid duct, and this is the another branch of the facial nerve. All these branches of facial nerve will emerge from this parotid gland. So this is the gland of, this is the parotid gland, this area. You can find that stuff here. This is this dark colored one. And this is the masseter. We have not opened that one. So coming to the some vessels of the face. So in front we find the facial artery, and behind we will find the darker facial vein, darker and little larger, and this is smaller and tortuous. You can see here this tortuous vessel which we find at the angle of the mouth, which comes all the way downwards. It is a branch, since it is a branch of external carotid artery, it comes from the neck and it crosses the mandibular base of the mandible and becomes so tortuous, reaches the angle of mouth. We have not yet traced it. So it reaches the angle of the mouth and it ascends all the way upwards and reaches the forehead here. See, this is where you can find again the facial artery. Reciprocately, the facial vein is formed by the supratrochlear vein and the supraorbital vein. Both unite to form facial vein. Let us assume that this is a facial vein. It is also called, at this point, it is also called as angular vein because it is near the medial angle of the eyeball. So this is the angular vein. Further, this angular vein becomes the facial vein. And you can see the facial vein right below the masseter. This is the region where you will find the masseter. And superficial to the masseter, you will find this parotid, the large parotid duct emerging from the parotid gland.